If you experience bladder control issues, you're not alone. It's a very common problem, even though people may not always want to talk about it.
But on this week's Health Talk, we are going to talk about it, and we'll focus on what is a very effective drug-free treatment, at least for some people. So stay tuned.
We're up next.
Hello, I'm Dr. Eric Mazur.
And I'm Dr. Andrea Peterson. Today we're going to talk about a private but extremely common problem, urinary incontinence. Our guest is Dana Fulton. She's a physical therapist with Norwalk Hospital's outpatient rehabilitation services.
Dana, thanks for joining us.
Thanks so much for being on the show.
Thank you for having me.
Well, urinary incontinence is so common, particularly among women who have had children. Why is it so common among women, and what does having children have to do with all that?
Well, you just hit it on the nail right there. It's the fact that when women are pregnant, they're carrying this extra load, so this extra weight. So that's putting a lot of pressure on their pelvic floor. So your pelvic floor are the muscles that are responsible for continence. So a lot of pressure is being placed on the pelvic floor, which stretches it out and makes it weaker. So therefore, they tend to have issues with leaking because their pelvic floor is not able to work like it's supposed to.
It's really the muscles of the pelvic floor and then some of the ligaments and how everything hangs together there literally that determines continence.
Yes, it does. Yes, it does. And actually, the event of actually childbirth in and of itself can also contribute to people having urinary issues because those muscles and the ligaments are stretched beyond capacity. So that can cause some urinary incontinence issue.
But it's not only women who develop urinary incontinence. Men can develop incontinence as well.
Men can have incontinence as well, partly because of prostate issues, especially later on in life, although we do see that younger men are developing some prostate issues, so they do tend to leak as well. But also, as a result of some sort of surgical intervention, that could be a reason why somebody is incontinent. And they're also finding like some hormones that are related, or the lack of hormones can cause some incontinence issues. So it is primarily women, but men have it as well.
And how prevalent is it among women? It seems to be that, I don't know, a majority of women past menopause have some degree of incontinence. Is that an overstatement?
No, it's true. Estrogen plays a huge role in your pelvic floor muscles, or keeping the tone in the pelvic floor muscles to keep them nice and strong. So when you don't have that, as they go through menopause, or the hysterectomies, when they don't have that estrogen going around again, then they're at risk of having urinary incontinence.
Go ahead, Richard.
Maybe you can just spend a moment telling our viewers there are a couple different types of incontinence, and maybe you could just go through that quickly.
Okay. The main types of incontinence are your urge and stress incontinence. Basically, urge is the tendency to go when you don't really feel that you have to go. It's like some sort of urge to go. And it's usually precipitated with some sort of trigger, cold, or like that key in the door, or running water. So your bladder contracts when you don't want it to. All right. The other type is stress. And basically, your bladder is just moving around because the muscles aren't strong enough to keep it in place. So you have some sort of stressful event associated with it, whether it be exercise, coughing, sneezing, even walking. All right.
So by stress, we don't mean anxiety stress. We mean
No.
physical stress, pressure in the abdomen that's transmitted to the bladder.
Yes, exactly.
Okay, and urge incontinence, so anatomically things work there, work properly, but it's just a sort of psychological misconnection?
Yes, exactly. That's exactly what happens. And so like in the rehab phase, when somebody comes to me, we try and see what we can do to try and get the mind to focus more, not to focus on the bladder as much, but on other things, so that way you don't have to feel like you have to run to the bathroom.
Maybe you can talk a minute before people come to you. Have they usually had some kind of evaluation or workup for their incontinence?
So yes, so usually they're going to their doctor of some sort, whether it be the uronologist, their OBGYNs, their PCPs. Yes, they take them through a bunch of urinalysis testing. And that can consist of something like an ultrasound, measuring the amount of pressure in your sphincters, measuring the amount of urine that comes out. There's a whole bunch of different tests that they go through before they actually come to see me.
And even something like a urinary tract infection may give you a transient incontinence because the bladder gets sort of twitchy, irritated and twitchy, and that can be satisfactorily treated with antibiotics.
Yes.
And it is worth having that evaluation too. There are other medical conditions that could cause people to urinate more often or more frequently, and you want to make sure that that's not what's going on as opposed to incontinence.
Exactly, and not only medical conditions, sometimes some medications can cause you to leak a little bit more.
Absolutely. That's a great point.
Diabetes could be a big one. So yeah, so you want to make sure you don't have any of these medical issues before we just say, well, this is stress incontinence or this is urge incontinence.
Yes.
So most folks should see their doc then as their first step, or their primary care provider as the first step with incontinence.
Right. They should see a doctor in general, not necessarily their primary care, but they need to talk to a doctor about it. So in order to come to see me for physical therapy, I need a prescription. So I need a doctor.
Okay, so a doctor has seen the patient and says this patient has incontinence and sends the patient to you. What happens?
So they come to me and I do my own assessment. So basically it's just like a subjective assessment. So I ask them a whole bunch of questions, a lot of questions. And then I do my own assessment. I do an external and internal assessment of the pelvic floor. Sometimes we might talk about some of the things that they do as far as eating, drinking, exercise, what they do at work. Sometimes lifestyle can actually play a role in incontinence as well, the type of job they do. Are they lifting a lot of heavy things, that type of thing. So, and then from there I determine how I'm going to treat them depending on what I find.
Well, give us some examples then. If you find urge incontinence, what do you do?
So if it's urge incontinence and is that actually like needing to run to the bathroom, what I would do is I would say, okay, we need to focus on something else. So you know how like when you were a little kid and you had to go to the bathroom, but you needed to hold off till you made it to the bathroom. What would you do? You would hold your legs together, so we would practice doing that, or you would focus on something else, count to 10, sing a song. So we will work on those type of things so that way you can focus on something else versus the actual leaking or going to the bathroom at that time.
Do you find that sometimes people get into a cycle where they feel the urge, it makes them anxious, and that increases the urge?
Absolutely, absolutely they do. So again, we do try and do these things that I just talked about. So mentally, you're focusing on something else because that's really what it is. It's all in the mind.
What I find, if I'm driving or something and I need to go to the bathroom, I find that if I can hold it back for a period of time, that urge then dissipates. And I've assumed, and please, this is asking a question, isn't that the contraction of the bladder that's making me feel like I've got to go? And then if I can get past that contraction and it relaxes, that relaxes the symptoms? Is that what's going on?
That is exactly what's going on. But that's hard for some people to do, especially in the beginning, because they just don't know how to do that. They just tend to get more anxious and more anxious and anxious, and they just leak.
So you want to go a little bit into how you can strengthen your muscles and teach yourself to hold it in?
So basically what we do is we do Kegel exercises, okay? So basically I'm teaching you how to strengthen your muscles either visually, so I would have to take a look, or I have you look via a mirror. Sometimes I use biofeedback, so that entails you using some sort of a sensor, either internally or externally, that we look on a screen so we can see you doing.
So actually measure the contraction?
So it actually measures the initiation of the muscles, not necessarily the strength of the contraction, but if you're able to initiate the fibers of the muscle to actually do the contraction. So that's what it does. And it also measures or looks at your ability to relax your pelvic floor. Because if you're a really anxious person and you can't relax your pelvic floor, meaning you can't relax in general, your pelvic floor isn't relaxed. So it's constantly spasming your bladder there, so you're going to be leaking. So sometimes we have to down train, and that allows us to see that.
So both distraction and relaxation.
Yes.
CP, now there are a lot of ads for the overactive bladder drugs. Is that something that you think should be an early treatment, or is this something you could probably train yourself around and avoid the medicine?
So it depends, because everybody's different. So for some people, they need that definitely. For other people, we can use all these different techniques to try and decrease the amount of anxiety that you have, so that way we can calm the bladder down, and then you won't leak as much.
How much of it is psychological? I've noticed with colleagues and friends, and some people have to go to the bathroom all the time. It just seems to be a habit for them, and other people, can go all day and not have to go to the bathroom. Is some of it just training yourself to be aware of how full your bladder is? I'm asking. I really have no idea.
Yes, so some of it is definitely something that happens over a period of time. Most of us, as we're young and as we're growing old, we go like we're normally supposed to go about every 3 hours. But because of lifestyle or stress or what have you, that changes. So one of the things in particular that people tend to do is they tend to go to the bathroom every time they see a bathroom, which is psychologically not the thing you need to do, because your bladder doesn't know what it's supposed to be doing. Every time you pass a bathroom, it thinks that it needs to go, so it's going to want to go. So you get that trigger, that urge to go to the bathroom. So you don't want to do that.
So you can literally
some
condition
of these are
yourself.
learned, yes.
to get a bladder contraction by
Yes.
looking at a bathroom.
Yes, you do. Yes,
Wow.
you do. Yes.
What about stress incontinence? So if people are struggling because when they cough or they sneeze or they try to exercise, they have leakage, what kind of techniques do you use with them?
So basically, it's pretty much the same as far as the Kegels are concerned. Because again, we're looking at the pelvic floor muscles, so we need to strengthen those pelvic floor muscles. So Kegels are key.
Is there a way you can describe Kegels to people at home that they know? What do you tell your patients to do?
So when you want to do a Kegel contraction, I said just pretend that you're urinating and you want to stop the flow of urine. So basically, stopping the flow of urine is contracting those pelvic floor muscles. And it should be a contraction which nobody should know you're doing. Because what happens is when those muscles are really weak, a lot of other things come in to help out. So you tend to hold your breath, you tend to squeeze your glutes a little bit more, your legs come together, and they tend to tighten up just to help with the contraction because those muscles are so weak. But that's what you really want to do, is focus on stopping the flow of urine via just
How
those
long does
muscles.
it, just on a very practical standpoint, how many minutes a day should you be doing Kegels? How often should you be doing them? And how long does it take till you start to see results?
Okay,
I mean, positive results.
so that's different for everybody because everybody's different. So I've had people come in where within like a week or two they notice a big difference. I've had other people that it takes like 3 or 4 months before they start to notice a difference. In general, what they say, the research shows anywhere from 24 to 80 contractions on a daily basis is really what you need to do. Anywhere from a 3 to 5 second contraction as well. And I typically have people do those contractions in different positions because your muscles have to learn how to work in different positions. So just not in sitting, just not in standing, just not while you're walking. It has to learn how to fire and control incontinence while you're doing everything.
Do you give people a regimen?
I do. So depending on what I find objectively, because again, I have to do like my own internal assessment, so I can tell how strong your muscles are, and then that will tell me what I need for you to do as a home exercise program.
You do them forever? Once you have it working, do you need to continue
Absolutely,
to do those
you do.
Kegels?
Absolutely, we need to exercise every part of our body forever, and these are just muscles, right? Just muscles that we don't like to talk about.
That's a great point.
So.
That's a great point. So beyond the Kegels, are there other techniques that people can use in their daily lives for things like stress incontinence that is not necessarily triggered by that urge or that psychological trigger?
Yes. So there are some other things. So there are like foods and drinks that you tend to consume that could be very irritating to the bladder. So there's a whole list of them. So I go over this with my patients, and sometimes you have to just take them out of your diet for a little while you're strengthening and conditioning your body to accept these things again. Sometimes you do have to cut it out completely.
What are some of the most common foods?
So the big one that most people do not want to stop drinking is caffeine. That's the biggie. Caffeine, alcohol, artificial sweeteners, those are the big ones. I would say those are definitely the biggest ones.
Licorice?
Licorice is okay. It's not that bad.
It's a mild diuretic. That's the reason I asked.
but that's usually not that big of an issue.
And you should point out, some people who are taking diuretics, just changing the time of the day they take them may be helpful.
Yes.
Because if you take it right before you go to bed,
Right.
it's going to get you up out of bed to go to the bathroom.
Right.
We have a little under a minute left. Before the show, you were telling us a little bit about bladder retraining and diaries. Is it helpful for people to start noticing and paying attention to the patterns of when they need to urinate?
Yes, because sometimes you don't realize that you're developing a bad habit, right? Because you think that this is your norm. So again, normal urination occurs about every 2 to 3 hours. That's when someone should be going to the bathroom every 2 to 3 hours. Some people don't realize that they're going like every hour, every half an hour even. Or the opposite, sometimes they're going every 5 to 6 hours.
So it's important to pay attention.
So it's to pay
as you said.
attention.
So unfortunately, that's all we have time for.
It's such an important topic. Thank you so much for being on the show to talk to our viewers about this. We'd very much like to thank our guest, Dana Fulton, for joining us on Health Talk today.
Please, you at home, send your questions and comments about the show to Andrea and me at HealthTalk at WCHN.org.
Thanks so much for watching.
Be well and stay dry.